This video is a brief overview of the Australian Mental Health Care Classification and the mental health phases of care. The Australian Mental Health Care Classification is a consumer-focused classification that mental health clinicians use to describe changes to the primary goal of care. The AMHCC captures information for activity-based funding. It includes a number of variables: the setting, the mental health phase of care, the assessment-only data item, the age group, the Health of the Nation Outcome Scales, or HONOS, the mental health legal status, and the Life Skills Profile, LSP 16. The AMHCC has 91 end classes across the community and admitted setting. The mental health phase of care describes the primary goal of care for a consumer at a specific point in time. It is reported prospectively and describes the type and intensity of care expected for a consumer. When we use mental health phase of care, it is vital to involve consumers, families, carers, and peer workers, and to incorporate their goals. The mental health phase of care describes the care, not the setting. It is used when the consumer is assessed. This happens on admission, on review, on registration, on a transfer of care between settings, or where there has been a substantial and sustained change to the clinical and consumer, families and carers' goals. There are 4 mental health phases of care, which describe the primary goal of care for a consumer at a specific point in time. The acute phase is about acute intervention. It is used when the primary goals of care are intended to reduce high levels of distress, manage complex symptoms, contain and reduce immediate risk. The consumer would normally present with acute symptoms and require timely intervention. In the functional gain phase, the primary goal is to improve personal, social, or occupational functioning, or promote psychosocial adaptation in a consumer with impairment arising from a psychiatric disorder. This can involve structured training and therapy. In the intensive extended phase, the primary goal is prevention or minimisation of further deterioration and reduction of risk of harm in a consumer who has a stable pattern of severe symptoms, frequent relapses, or severe inability to function independently and is judged to require care over an indefinite period. In consolidating gain, the primary goal is to maintain the level of functioning or improve functioning during a period of recovery, minimise deterioration, or prevent relapse where the consumer has stabilised and functions relatively independently. Consolidating gain may also be known as maintenance. We'll now look at assessment only. Assessment only is a data item. It is not a mental health phase of care. Assessment only is information gathering to enable the assessment of a consumer or potential referral for treatment services if required. It is used when a review does not lead to the consumer being placed in one of the 4 mental health phases of care immediately after. If the assessment outcome leads to acute, functional gain, intensive extended, or consolidating gain phase being selected, then the assessment is included as part of the chosen phase. Therefore, assessment only does not constitute a mental health admission or activation. In community settings, assessment may take more than one activity and involve multiple sources of collateral. To summarise this short overview, the Australian Mental Health Care Classification is a consumer-focused classification that mental health clinicians use to describe changes to the primary goal of care. The mental health phase of care is a key concept in the AMHCC and describes the primary goal of care for a consumer at a specific point in time. It is reported prospectively and describes the type and intensity of care expected for a consumer. There are 4 phases of care. Assessment only is a data item within the Australian Mental Health Care Classification. The mental health phase of care should consider consumers, family, and carers' goals. It has a clinical utility and it helps determine future funding, manage resources, and improve local services. You can explore ways of using mental health phase of care with your own team using the resources linked to this video. There are meeting guides and presentation resources, as well as consumer journey maps. All of these can help your team build familiarity and a shared understanding of the phase of care, and let you enjoy some of the benefits we've shared with you here.